short. Hi, this is Elizabeth Clare Brewington with Elton Brewington, and we have Dr. Sabine, and she's launching her book. And as you know, we love books. If you would like to get a copy of her book and stay healthy, she'll tell you why. Dr. Sabine, you were talking in the previous video about COVID. So tell us, how does COVID relate? And then also tell us all about this amazing book that you've written, and why should we get a copy of it?
So we found COVID, our lab found COVID in the stools. We didn't find it as one little segment. We actually found the whole genome, the whole entire virus from, region 1 all the way to the end. And we were able to see actually 33 mutations within the 8 patients that we analyzed. So it was fascinating to see that not only is the whole virus in the stools, but different viruses. So therefore, this is not a contamination. This is literally a different virus in different people. When we looked at COVID-19 and the stools of those patients, we also identified possibly a signature microbiome that could reflect maybe why some patients are doing great and why some patients are not. In fact, we're doing a lot more studies before it gets published. And as you know, the process of publication in medical journals is very tedious, a lot of peer reviewed, and it takes time. In fact, this paper that was just published in Gut Pathogens on finding COVID in the stools took 6 months of peer review, but they were nice enough to put it as a preprint so that others could start the research. And so I think anytime there's a crucial research that's out there, and that's going to be questioned, right? Because everybody's going to say, wait, how did she find it? Why? How is this real? And the paper was sent, I know, to the WHO. The paper was sent everywhere, every doctor, on Gut Pathogen. They were peer reviewed, that reviewed it. They made us do a better job of explaining the paper, which we were thankful for the reviews, because most people don't like to be in peer review for 6 months, but they made our paper a lot better. Because we had to explain, the duration. We ended up finding that one of the patients had COVID for 45 days and it was still present in their stools, and they were still symptomatic. So, it's fascinating, because from the time you do a throat swab to the time that you develop symptoms, a long time can happen. Or even from the time that you do a throat swab to the point that you don't have COVID, or you're asymptomatic. So the throat swab is just a look at a small segment, as opposed to looking at the whole entire gene. So that was what was fascinating with COVID, and also my knowledge of what I know so far on the microbiome, and having performed fecal transplant for C. diff and having treated H. pylori, as a gastroenterologist. I knew that this bug was going to eventually be a problem of the GI, right? Because eventually GI is always on the forefront of, we're kind of like the soldiers with our scope, and we're removing tumors, and we're, figuring out fecal transplant, doing fecal transplant. So I knew that fecal transplant taught me something about the microbiome. What do we do when we do fecal transplant in a patient that has C. diff, which is a bacteria, like I said, we kill off with antibiotics? We just put a whole bunch of microbes in there, right? So that was the first thought for me, is, wait, what am I doing when I'm doing fecal transplants? I'm taking a whole bunch of microbes and I'm suffocating the bacteria that causes C. diff and secretes the toxin to kill the human being, right? So therefore, because I'm doing that, it makes sense that if I want to get rid of a virus, I have to use other bugs. And so that was the whole train of thought with Dr. Brewery to come up with solutions for COVID. So why did I write the book? And I published it last year in 2020 for 2 reasons. First of all, I didn't want to sugarcoat it, like I said. I didn't want it to be microbiome and all fancy. I wanted people to understand, you're going to have microbiome pills. It's poop. That's it. I mean, like a fancy way of putting it, but it's essentially, what is poop? It's microbes. We tend to look at poop as like, disgusting. And yes, even for me, I mean, believe me, playing with it, putting it in patients, disgusting beyond. But you have to go above the disgusting and into the courage zone to kind of say, you know what, I'm going to play with it. I'm going to look at it. I'm going to evaluate to find the answers. And that was the whole reason in my evaluation, in my reading of the data, I wanted a book that explained in layman terms to people, but also kind of be a little bit funny, because that's the kind, even though my kids say I'm not funny, I tend to disagree, you know. But all
They
kids,
don't know.
they, you know, I don't know. I called the book "Let's Talk Shit." You know, I mean, I think it's pretty funny.
Right.
So
Yeah, no, really, it is. I mean, would you think about it? God in His infinite wisdom, because once you've realized that 70% of your, immunity system works based on from your intestines. From your intestines, I mean, that means your body is got this, titanium shell around it,
right.
able to heal just about anything, but you have handcuffs on it because your large intestine's backed up. You can't work right. You can't work right. So this is amazing. Now, in God's mind, He's saying, you're just full of it. Really, empty out.
God definitely has a sense of humor, because when I was 5 years old, and I write it in the book, in my biography, I wanted to understand life. I was obsessed with where do we come from and where do we go after we die, right? So I went into medicine to understand that. And I remember as an intern, I used to be obsessed asking patients that were near-death experience, asking them, what was it like? Where were you? What happened to you? And come to find out, you know what? Nobody really, there was this white light. Everybody tells you the same story, but it didn't really get me closer to understanding the meaning of life. And then discovering the microbiome and looking for the first time at the species of digging deep into the forensics of the gut, and looking at the species that exist in my gut and saying, oh my God, this is the same bacteria that existed in the time of Abraham. How did that bacteria get into my gut? Do you know that C. diff?
Yeah.
C. diff, the same bacteria that we are trying to kill with antibiotics and only resolve with fecal transplant, is 10 million years old. So imagine if we end up killing C. diff, and that's what sustains humanity. That's ridiculous, right?
Yeah, that's true.
So God is showing me this path. And when you do look into the microbiome, you see the presence of God even more, because you see how these microbes, trillions of bugs, are all cohabitating together. What we see as stools is actually a microscopic universe of microbes. What COVID is, and why I wasn't scared of COVID, is it's just a sign like C. diff. When I was doing clinical trials on C. diff, and I was treating patients with C. diff, I never thought for a moment that I would catch C. diff. Here I am, not wearing masks, I'm not wearing gloves, I'm seeing patients with C. diff, and I never caught it. Why? Because it's not transmitted that way. It's not transmitted by me giving it to you. It's transmitted only if your microbiome is altered, only if your diversity is altered. So the beauty for me about the microbiome is that it's a look at the microscopic level of an invisible universe. COVID is invisible. It's nanometers. You can't even see it. You can't even think about seeing it, except unless you do like the technology that we do, which is going deep into the sequence of the microbe and then sending it to the sky and aligning all the particles. So here's a look into a vast universe that we had no idea what these microbes are doing. There's got to be a power out there overlooking all that. And of course, because guess what? The microbiome is in charge. The microbiome is right now, COVID-19 is in charge. It put humanity in quarantine. So we have to be humble, and we have to say, maybe there's a message to this virus, right? Maybe the virus is telling us we need to look at what's going on in the microbiome. When we have diversity in the microbiome, we have peace and we have health. When we have lots of diversity, we have disease. We have Crohn's, we have autism, we have Alzheimer's, right? Loss of diversity. When we have an imbalance, too much of the bad stuff and too little of the good stuff, we have disease. So it's all about the balance, right? I mean, even in life, it's about the balance, right?
Right. So what would you like to see? You've got this book and it's out there. What is your interpretation of a great reception regarding the book?
I think, you know, I want people to be aware. I think, you know, for years and years of being a gastroenterologist, people come to me with, I'm so bloated, I'm so gassy. So I'm tired of repeating the same story over and over again. So I basically wrote it in the book, and I gave a couple of, you know, recipes that basically could help patients. So that's one thing. People, there's a chapter called No Shit, which is for people that are constipated. So instead of repeating the story,
very good.
Don't eat the bananas, don't eat the chocolates, repeating the stuff that I always repeat. I said, you know, just go to my book and read the chapter No Shit. And then same thing, people have questions like, well, autism, you know, can fecal transplant help with autism? So I wrote a chapter to kind of show where we are in the data, because obviously we're not there. This is the beginning. I'm starting this movement. I'm starting the movement with the Biome Squad. I'm starting, and I joke in a way because I say, you know, the Biome Squad, saving the world one microbe at a time, you know? And so that's what it needs to be. We need to understand the microbiome better. We need to understand the interaction of these microbes. Which one is a good one? Which one is a bad one? Which one is balanced, non-balanced, to recreate the balance?
Right. Wow, Dr. Soka. This is amazing. That we can't wait to get the book, you know, so that we can delve into it and really get, and also we can't wait to get you exposed to our audience so that they see the value, the craftiness, and the unique approach that you've taken to present and share this information with people.
So once again, we'll make sure, can you hold the book up, and we'll make sure that you have a link to where you can get the book from, and then you want to come to our conference, and we're giving away tickets and lots of good stuff. So there you go. Thank you so much.
One element that we've put a little emphasis on is diabetes. Now, the pharmaceutical firms are collecting almost $385 billion a year from diabetic sufferers. You know, and if this can have an impact on that, or elements of that, and I believe that it can. You know, what an amazing place would be in. You know.
Yeah, so, one of the doctors that is speaking at the event is Dr. John, and he's got a book about reversing diabetes through diet and the gut. So, you know, we're going to be really, you know, we're not trying to replace the primary care physician, or we're not trying to, but we're just trying to give you good, old-fashioned advice from book authors that, you know, you would then have to do your own routine and your own research and see what works for you. But we encourage you to buy these books and attend. So that's what we do.
Amazing.
So thank you so much, www.brightsideglobaltrade.com.